Hi, my name is Brianne Cipriani. Today I will be performing a head-to-toe assessment on a patient. I will begin by ensuring that I prepare the room properly. I want to make sure that the temperature is comfortable for the patient, that it's well lit, and I also want to prepare that the room is properly equipped with all the supplies that I could potentially need for the exam. It is important to note that there are several reasons why you would perform a head-to-toe assessment on a patient. You could perform a routine assessment for wellness. People do get head-to-toe assessments to determine eligibility for insurance, jobs, military. They're sometimes used also for admissions into hospitals or long-term care facilities. Today we will be performing a routine assessment for wellness on a patient. I will begin first by performing proper hand hygiene, which would be the beginning of the wipes, and then I will go and introduce myself to the patient. Hi, Luba.
Hi.
My name's Brianne. I'm a student nurse. I will be performing the assessment on you today.
Okay.
How are you?
I'm good. How are you?
Good. If you could follow me, I just got to gather some information and weigh you, if you don't mind.
Sure.
If you could please remove your shoes and step on the scale.
I don't want to see my numbers. Should I keep
And
my
Luba-
shoes up?
No, you can put them back on. Luba, what's your name
Luba Hughes,
and your date of birth?
May 2nd, 83.
Do you know what the date is today?
It's the 14th of November, 2012.
And do you know where you are?
It's the doctor's office, New West Springfield.
Okay, thank you. Follow me. While I walk to first it is important to note that the patient is oriented to person, place, and time, ×3. She's cognitive. As she walks to the room, I will follow her and I will take a general survey of her gait, gross motor movements. Upon introduction, I will observe her appearance. If she is groomed, she certainly seems well groomed. Presence of any odors, they are absent. She is dressed appropriately for the weather today. And I will observe for coordinated movement. So, Luba, if you could go to room 10, please. Once I get into the room, I will obtain her height here. If you could take your shoes off again, please.
I can help you reach it.
Oh, thank you. And put your back to the wall. Alrighty. Okay, all set. Thank you. I will make sure that I provide proper privacy for the assessment. All right, Luba, if you could please take a seat. I'm going to just gather some history information on you. When I get in the room, I want to make sure that I gather a little history data on the patient. Before I dive into the assessment, I think it's important to note that I want to build on a therapeutic relationship with the patient before I ask them to allow me to perform a more invasive assessment. It's also important to note their ability to communicate appropriately, that their speech is clear and fluent, that they are capable of maintaining eye contact with me, their eyes are open, and it's also important to note upon introduction any facial symmetry. Alright, Luba, are you currently experiencing any pain?
No, no pain.
Alrighty. I'm just going to give you this pain card here. If you could read it to me below and let me know where you would stand on that pain from 0 to 10. Have you?
It's under Sierra, it says doesn't hurt, so that's where my big
Okay.
experience now.
Thank you. So by clearly reading the pain card, she demonstrated her ability to understand written words. To read written words. So she's not experiencing any pain. Are you having any difficulty sleeping?
No,
Have you had any headaches recently, pain in your chest, abdomen, arms, or legs?
no, nothing recently.
Okay. Any recent head trauma?
No,
Okay. Have you experienced any nosebleeds,
no,
dizziness,
no,
or a runny nose?
no,
Have you had a cough?
not recently.
It's not productive. You're not bringing up any sputum.
No.
Okay. How has your appetite been lately?
I eat a lot.
Okay. Do you have any difficulties swallowing?
No,
Any coughing,
no.
Sore throat?
No,
nausea, or vomiting?
no,
Okay. Have you had any recent traumas limiting your range of motion?
no,
Alrighty. Do you smoke?
no,
Do you have allergies?
no,
Any exposure to pollutants, smog, or any environmental pollutants, occupational pollutants, asbestos?
not highly. No.
Okay.
I would not say so.
Do you have a history of HIV or substance abuse?
No,
And any tuberculosis exposure?
no.
Have you ever been tested for tuberculosis?
Just PPD test.
Okay. And do you
That was negative.
Okay. When was your last bowel movement?
This morning.
Was it difficult for you?
No, it was easy.
Okay. Do you have any family history of cardiovascular abnormalities?
My mom, but not really.
Does she have hypertension or?
She does.
Okay. Have you experienced any abdominal pain recently?
No,
Okay. Any hemorrhoids? Rectal bleeding? No? Okay. Have you received your HPV vaccine?
no,
Alrighty. And to your knowledge, have you ever had a history of HPV or other sexually transmitted
No.
infections?
it's clear.
Okay. When was your last date of menses?
2 weeks ago.
And do you recall the age of onset for menses?
12.
Okay. Have you ever been pregnant?
Yes.
How many pregnancies?
2.
And were they vaginal or cesarean?
Vaginal.
Okay. And have you ever experienced an abortion or a miscarriage?
No.
Alright. Are you sexually active?
Yes.
And within the past year, do you recall how many sexual partners you have had?
Just 1.
Okay. Do you practice safe sex?
Yes.
Okay. And have you had any abnormal discharge, foul odors,
No.
vaginally? Okay. How about your urine?
It's clear.
Do you, when you do urinate, do you observe the color?
Yeah, it's clear and yellow.
And any
Blood
blood in
urine.
your urine?
Not that I've seen.
And do you have any problems urinating?
No, not at all.
Have you experienced any trauma to your legs lately? Anything inhibiting
Not
your ability
recently.
to walk?
No, I could walk. Even high heels.
And do you ever experience any numbness or tingling in your legs or toes?
No.
Do you practice any religions?
I do. Pentecostal.
Okay. And do you attend church frequently?
Yes, every week.
Do you have access to a good support system at home?
Yes, my husband, my family.
Okay. And there's no abuse in the home?
No.
Alrighty, so after taking a brief history of the patient, I will allow her plenty of time to change into proper garments to perform the more invasive assessment. So Luba, I will leave the room and I just will ask if you can put this Johnny on here and drape this over your waist. And I will be back in a couple minutes to perform the rest of the assessment.
Thank you.